Diabetes or diabetes mellitus, as it is medically known, is a disease which affects all the organs of the body, including the heart. And in the long run, it causes damage to any of these organs. Unfortunately, it is a disease which is very prevalent in India, mostly in South Asia. The disease, as compared to Western countries, the incidence of diabetes is very high, partly genetic reasons, partly dietary reasons. And this it occurs in a very young age, and it is important to diagnose diabetes early on and keep it under control. Mostly in the early stages, it is asymptomatic, and it can only be detected by doing regular blood tests. It runs in families, so if you have a family history of diabetes, it is very important to have testing your sugar levels regularly so that it can be diagnosed early on and appropriate measures taken. Early on, the disease can be controlled by diet. Later, of course, you may need medicines, and it is also important to look for complications of the disease in the long-term stages and take appropriate measures to prevent complications. There are many ways of doing this which your doctor will be able to advise. As far as coronary artery disease is concerned, our population, the Indian population, 50% of our patients who come for bypass surgery are diabetic. This is as compared to less than 20% in the Western countries. This shows the impact of diabetes, that the impact diabetes can have on the coronary arteries and the blockages that are caused by this disease. In that respect, it is very important and a very common disease which should be treated early by appropriate measures.